Some private hospitals are reportedly unable to accept more COVID-19 patients, partly due to the unpaid claims of PhilHealth. PhilHealth spokesperson Rey Baleña joins us over the phone to respond to this issue. Good afternoon, Spokesman Baleña. How is PhilHealth addressing its supposed slow processing of reimbursement claims by hospitals?
Well, just good afternoon. PhilHealth remains committed to our partner hospitals. In fact, on the issue of turnaround time in our claims processing, on national average, PhilHealth has been paying on national average mga some 39 days for these claims. So insofar as turnaround time is concerned, we are not that delayed insofar as payment is concerned.
Well, what are your next steps now? You have the palace ordering PhilHealth to expedite payments to private hospitals.
Yes, we have been expediting claims payments. Just what we would like to clarify in this issue is that what is being glossed over is the fact that a total of I'm sorry, I'm just looking at my data at the moment. Yeah, a total of 84.27 billion has been paid by PhilHealth now, and that is in the span of 2018 to 2020. So that represents 92% of some 8.4 million claims that we received from PHAP member hospitals. And the truth is, there are now 1.14 billion that are still in different stages of processing. But what we would like to point out now, especially to our members and observers, is that some 5.6 billion have been returned, either returned or returned to the hospitals or denied payment. So we would like to point out that we have to return these claims to the hospitals because these claims are needing compliance to rules of PhilHealth.
Again, sir, if I may clarify, they were returned on what account specifically?
Yes, they were returned because these claims are with deficiencies. For example, the required documents are unavailable, incomplete, inconsistent, or either inconsistent or unreadable. And some claims require more documentation, and we have noted discrepancies in entries in these claims. In particular, claim form 2 is not properly accomplished, and there are errors in the claim form 4. So, just some 2.5 billion worth of claims have been returned to the hospitals, and our appeal to our member hospitals is to immediately correct these claims and immediately return to us so we can act on this return to hospital claims.
Okay, given that, sir, you have PHAP saying that their members now are actually forced to downsize operations due to the agency's failure to actually pay claims. Are you willing to hold a dialogue with PHAP regarding this matter, and what solutions do you hope to come up with?
Yes, PhilHealth is always open to dialogue. In fact, just today, we had a dialogue with the Philippine Hospital Association, and one of the attendees was the president of the PHAP. So we have always been open to dialogue, and in fact, this is one solution that we have been advancing since last year. Our president and CEO has directed all our regional offices to open up and conduct reconciliation of claims data so that we would be able to point out which claims are needing compliance and which claims are already in process and which claims are already denied. And so they don't have to include these claims in their receivables.
Okay. Sir Rey, if I may just go back to a point that you raised earlier, you did mention that you were able to pay as much as 845 billion pesos, but that is from a span of 2018 to 2020. But if we try to focus solely on the COVID-19 pandemic, how much has PhilHealth paid, FAPI?
Well, actually, my data now is a data covering 3 years, But I'd like to point out that overall, for 2020, PhilHealth paid all its accredited healthcare providers some 91 billion pesos, and that represents 84.7% of all the claims that were received by PhilHealth. And some 459,000 claims have been denied, while 653,000 claims have been returned to the hospitals. So you see, these claims are quite voluminous, and so the only solution here is really for our partner hospitals to be careful in their claims, because prudence will dictate that we have to return those claims if they are not fit for payment, if they are not, if they are with deficiencies, or these claims are not conforming to our standards.
Okay, sir, next question is PhilHealth also covering the expenses of COVID-19 patients staying in hospital tents? And what can you say about medical facilities supposedly charging as much as 1,000 pesos per hour for these temporary tents?
Well, we would like to again reiterate our statement that we earlier issued, that if the services given to the patients currently staying in tents are part of the inpatient care, then this should be covered by the current inpatient benefits of the program. So we would like to clarify lang that what was being referred to during that particular Congress hearing is that the stay of the patient in tents of community isolation units that are not yet accredited with PhilHealth. So if the facility is not accredited with us, and we were referring to community isolation unit tents back then these are not compensable. But again, Jess, we would like to reiterate that not one should be left behind under the Universal Healthcare Law. And we are now reviewing our policies so that we should be able to provide clearer guidelines, all in the objective of providing adequate financial coverage for our patients, but of course without compromising quality of care.
All right, that's definitely something that we are going to keep tabs on. Do keep us posted. PhilHealth spokesperson Rey Baleña, thank you for your time, sir.